Alright everyone, Eric Solomon here with Physio Fitness Cambridge and CrossFit Rebuild, and today we're talking about neck pain or interscapular pain. So that's pain basically between the shoulder blades. This is really common, especially for people's dominant arm. So if you're right-handed, it's most likely you're going to get some of that pain on the right side between the shoulder blade and the spine. So in those muscles there, it can feel like sort of a burning, aching sensation that gets progressively worse throughout the day. So we talked about before, number one, we want to get into a pain control position. So the first thing that usually involves is kind of hands in the hips, chest tall, shoulders are back. That takes the pressure off those irritated tissues, lets them relax, lets blood flow back to the area, get the healing process going. We then want to get into, this would be sort of stage 3 of our treatment process, strength and conditioning work. And the issue with mechanical pain or chronic pain is that our endurance is diminished or decreased. So what we want to do is start working on increasing the endurance of those muscles that are strained. So if I'm working with a client to get rid of that type of pain, what I would have them do is in standing is an isometric contraction. So we're going to contract the musculature between the shoulder blades without creating movement. That's what an isometric contraction is. So we're flexing muscles, but we're not creating movement. So what this would look like is chest tall, head tall. I'd have them do sort of an imaginary row. So as if they were holding a band, pinching the shoulder blades back and pulling the fists to about chest height. And you should feel the muscles contract in the back. So if I'm pulling back, and I'm going to hold that for 10 seconds. Again, while I'm doing it, making sure that my chest is tall, my head is tall, and I'm not slumping forward. All right? So 10 times, 10 seconds. In between each set, you're going to rest for 10 seconds. That's going to, again, let the blood flow back to those tissues. And when you're resting, we don't in between and sort of undo everything we've been working on. As you're resting, just hands in the hips, let that muscle kind of relax and go loose. As we talked about before, rule number 1 is we can't cause or reproduce any symptoms. So if I'm trying to do something that's going to get rid of shoulder pain or neck pain, I can't be doing something that is causing neck pain. So this exercise, for it to be therapeutic, has to be completely pain-free. So how do we do that? So number 1, we can adjust the amount of intensity of that contraction. So I can just gently hold myself there, or I can really aggressively get those muscles turned on. So you think about kind of tuning your volume in the car radio. You need to tune the intensity of that contraction to as much as you can handle without reproducing the symptoms. So we're doing 10 times, 10 seconds with as much intensity as you can handle and making sure you stop before you get into symptoms. All right, so give that a go and we'll catch you next day.